You can now mark an encounter as a transition of care encounter in the reason for visit step of the intake checklist or in the review step of the exam stage. We're updating the transition of care workflow. You're required to complete this workflow if your organization participates in Medicaid Promoting Interoperability Programs, formerly known as Meaningful Use. The Health Information Exchange Measure calculates the percentage of transition of care encounters that have an electronic summary in consolidated clinical document architecture format linked to the encounter. Transition of care is the movement of a patient from one setting of care to another. This includes hospital, ambulatory primary care practice, ambulatory specialty care practice, long-term care, home health, and rehabilitation facility. At a minimum, this includes all transitions of care and referrals that the clinician orders. In this workflow, the record of care documents related to the transition of care from one physician to the next are transferred electronically and identified by AthenaNet. Users can manually check or uncheck the newly referred patient or patient being referred back checkbox to appropriately designate if this visit is related to a transition of care. If a transition of care document is found since the last time the patient has had an appointment, AthenaNet automatically checks the newly referred patient or patient being referred back checkbox. Electronic summaries found that will auto-check the encounter as a transition of care include summary of care, continuity of care, referral note, and discharge summary. The user will go to the Document for Discussion section of the exam and check off the document that pertains to the transition of care. Marking a transition of care document as discussed will satisfy the inbound Medicaid Promoting Interoperability Health Information Exchange Measure. If the newly referred patient or patient being referred back checkbox is checked, and there is no transition of care document marked as discussed, you will then see the question, "Electronic summary was not found. Have you requested it? Yes or no?" This is a transition of care encounter, but you are unable to retrieve a record of care document or have requested a document, you would select yes. This will exclude this instance from this measure. If you do not respond to this question, or say no as a response, you have not met the requirements for the inbound Medicaid Promoting Interoperability Health Information Exchange Measure. In the full encounter summary, the Chief Complaint section will say Transition of Care Encounter. The documents marked for discussion is also included. This concludes the demo. Thank you for listening.